Rheumatological disorders are the musculoskeletal disorders, means muscle, ligaments, tendons, soft tissue around the joints. So it's mainly disorders or disease which affects the joints and the surrounding structures. So if I want to say in the me, like this is a joint and these are the soft tissues, cartilage, ligaments, okay, these are the muscles. So rheumatological disorders means the involvement of these structures around the joints. बॉडी के मेन organs है heart, lungs, brain, kidneys. So all the organs can be affected by rheumatological condition.
Namaste and welcome everyone. I'm delighted to have you join us for today's another impactful health awareness session. Today's discussion revolves around a group of diseases that are often misunderstood but can significantly impact one's quality of life. Rheumatological diseases. To help us understand this complex subject better, we are joined by one of the most experienced and respected names in the field, Dr. Jayanta Thakuria, Director, Internal Medicine and Rheumatology, with over 20 years of clinical expertise in treating autoimmune and rheumatic diseases. Welcome, Dr. Thakuria, and thank you for being with us here today.
Thank you.
Dr. Thakuria, to begin with, could you please explain what exactly are rheumatological disorders?
Rheumatological disorders are the musculoskeletal disorders, means muscle, ligaments, tendons, soft tissue around the joints. So it's mainly disorders or disease which affects the joints and the surrounding structures. So if I want to say in the me, like this is a joint and these are the soft tissues, cartilage, ligaments, okay, these are the muscles. So rheumatological disorders means the involvement of these structures around the joints.
Dr. Thakuria, moving on to the next question, what are the main causes behind these conditions? And are rheumatological disorders or diseases curable, or are they typically long-term conditions?
The main cause of rheumatological disorders or disease are the genetic factors and the epigenetic factors. Genetics means something that runs in the family or say hereditary, and the second one is the epigenetic. Those are the factors that may aggravate the condition, like history of trauma, infection, lifestyle, then come food habits. So these are the epigenetic factors. So both these factors combine together to cause the disease. And secondly, about this whether it's curable or not, it is not curable permanently. It is treatable, and with medications we can control the disease activity.
Dr. Thakuria, in your OPD, you might see many patients complaining and coming to you. What are the typical symptoms that patients present with to you in your OPD, and which organ systems can these diseases affect?
See, rheumatological disorders, अगर मैं कहना चाहता हूँ तो ये it can affect all the organs of the body, starting from a hair till the tip of the toe. तो ये kidney, lungs, heart, skin, joints, every organs are involved. And normally हमें जो most dangerous and dreaded complication is that जब ये kidney involve होता है तब ये बहुत खतरनाक हो सकता है, इवन आपका लाइफ की रिस्क भी बढ़ जाता है.
Dr. Thakuria, talking about how dangerous or life-threatening can rheumatological diseases be if left untreated?
बॉडी के मेन organs है हार्ट, लंग्स, ब्रेन, किडनीज. So all the organs can be affected by rheumatological condition. किडनी मोस्ट कॉमनली अफेक्ट होता है कुछ कंडीशन में, जैसे ल्यूपस. और अगर ये आप प्रॉपरली नहीं ट्रीट किया जाए टाइम पे, अगर इसको प्रॉपरली इलाज नहीं किया जाता है तो इट कैन लीड टू किडनी फेलियर एंड इवन डेथ. सिमिलरली आपको ब्रेन अफेक्ट हो सकता है, हार्ट ऑल्सो इट मे अफेक्ट हार्ट ऑल्सो. सो इट्स अ वेरी डेडली condition if misdiagnosed or are not treated properly.
Dr. Thakuria, thank you so much. Moving on to the next question, I would like to ask, how do you usually go about diagnosing these conditions? Are these specific tests or markers you look for?
Yes, diagnosis is mainly by clinical examination and history. Screening test we can do for a screening test like ANA by immunofluorescence technique. It can screen almost most of the rheumatological conditions. Though few condition it may be negative, but in most cases, ANA by doing an ANA test, we can screen the rheumatological conditions.
Thank you, Dr. Thakuria. Dr. Thakuria, once diagnosed, how are these diseases managed or treated? Is the focus more on symptom control or long-term remission?
से नंबर वन इज पेशेंट्स को ठीक होना बहुत जरूरी है. व्हेन पेशेंट कम्स टू द ओपीडी दे कम विद सम सिम्टम्स, तो सिम्टम्स ठीक करना भी जो बहुत जरूरी है. बट द मोस्ट इंपॉर्टेंट थिंग इज दैट we should try to control the disease activity, and for that we have drugs to control the disease activity. So we control both. We have to control the disease activity, we have to control the symptoms also.
Now, Thakuria, could you share some insights into the latest treatment modalities that are available in the field of rheumatology?
Rheumatological conditions, आज से 20 साल पहले rheumatological diseases are treated mainly with painkillers, and इसके बाद धीरे धीरे आपका disease modifying agents have come into play. But nowadays lots of molecules are there, जैसे biologicals. These are some molecules, some of the molecules that completely change, alter the disease activity. So we treat them as soon as we make a diagnosis. If the patient is not responding to normal therapy like disease modifying agents or immunosuppression, हमें फिर biologicals देने की जरूरत पड़ सकता है, and patient respond very beautifully with biologicals.
Thank you, Dr. Thakuria. What are some of the most common rheumatological conditions you frequently encounter in OPD practice on daily basis?
Some of the most important rheumatological conditions हमें जो day-to-day activity और day-to-day OPD में we have to come across. One is gouty arthritis, very common. Number 2 is the rheumatoid arthritis. Number 3 is the lupus, and some other rare conditions are also there, but I don't want to mention those names because it's not very commonly found. But these three conditions like gouty arthritis, rheumatoid arthritis, and lupus, these are the three most commonly diagnosed. These are the most three common conditions we see in rheumatological OPD. Rheumatology OPD.
Dr. Thakuria, you have had a very long career spanning of about 20 years and having the clinical expertise in rheumatology and internal medicine. So, there are many cases that you might have come across, particularly interesting or unique cases that you feel would help raise public awareness.
One of the most important rheumatological condition is back pain in young adults, non-traumatic back pains, and which we often misdiagnose or which we often miss the diagnosis. This is called ankylosing spondylitis, and it has a very good response with treatment. And if we treat it early, इसका response बहुत अच्छा है और patient disease activity can be controlled and the disease can be reversed back to some extent. So spondylar arthropathy is a very common condition, or I mean to say are the very good rheumatological disease which can be cured or not cured, which can be treated or can be managed with treatment.
Dr. Thakuria, what message would you like to convey to your patients in general public or general public regarding early diagnosis, lifestyle modification, misconceptions that people have about rheumatological disorders?
So rheumatological conditions are mainly autoimmune conditions. Autoimmune के मतलब बॉडी के जो आपका इम्यूनिटी है, this is a misfunction or dysfunction of the immune system, which may lead to your body immune system disturbance, और ultimately ये आपका body immunity dysfunction के कारण कोई body organs affect कर सकते हैं. But अगर इसको हम early diagnosis करते हैं, then we can reverse the disease process with some newer molecules. But if we miss the diagnosis, अगर इसको हम delay करते हैं, then we may land up with multi-organ failure or involvement of the kidneys or involvement of the brain, which will be the complications of the rheumatological condition. So it's something like if we treat it early, then the disease can be reversed back. बट इफ यू मिस द डायग्नोसिस देन इट्स वेरी डेंजरस. सो हमें लोगों को ये करना चाहिए कि आपको कभी भी ऐसा कंडीशन हो, जैसे आपको हेयर लॉस हो रहा है, जॉइंट्स पेन हो रहा है, आपके स्किन में रैशेस आ रहा है, जैसे बटरफ्लाई रैश गोइंग आउट इन द सन, और सपोज यू आर हैविंग ब्लीडिंग इन यूरिन और पेशाब में खून आ रहा है, और आपको बॉडी पेन, लेथर्जी, अर्ली मॉर्निंग स्टिफनेस, डिफिकल्टी टू गेट अप फ्रॉम बेड, as a condition, if you're not making a proper diagnosis, you're not able to find out कि क्या कारण से ये हो रहा है, then you have to look for rheumatological conditions. And these are the things we should be make aware of. And if we can treat it early, we can reverse the disease process.
Thank you so much, Dr.
Thank you.
Thakuria, for joining us today.